Hi, my name is Catherine Rebant-Payne, Director of Marketing and Communications at Oakland Family Services. I am here today with Amanda Robertson, who is our early childhood mental health specialist in our Children's Learning Center here at Pontiac. We're going to be talking today a little bit about what she does and about mental health issues that she is seeing in our Children's Learning Center. So, Amanda, first off, could you please tell us a little bit about what you do? What is your job in the Children's Learning Center?
So it's my job to support the classroom. So I work with the kids who have more challenging behaviors. Some of the kids can act out aggressively or be destructive. So supporting the teachers, helping the teachers figure out ways to individually support those children and work with those kids to improve the overall learning environment so that everyone can be successful.
So, what type of mental health and trauma issues are you seeing amongst the kids in the classrooms?
A lot of the trauma stuff comes from the kids' backgrounds. So all of our kids are at risk in some way. So some have witnessed violence or have been a part of an abusive situation. So they come in with a lot of anger that they don't know how to handle, or maybe they know that mom's been really stressed due to a relationship or financial issues. So they're all coming in trying to kind of wrap their brains around what's going on without really understanding it. So a lot of it comes with just, the constant stress and things that they've been exposed to that are coming out in their behavior.
How does that translate in the classroom? What does that look like in the classroom behavior-wise? What do they do?
It can come out in their social interactions. They become more aggressive, or they become so overwhelmed with emotion that they can be destructive, and they're just trying to make sense of everything. But at 4, there's only so much they have control over. So it's really working with the teachers to support those basic needs, making them feel safe and making sure that they're full and they're rested before we try to think that they're going to learn anything else, just providing those basic needs for them to create that safe environment.
And that must, if they're dealing with all those things, that must really impact their ability to learn, right?
Yes, for sure. So if they're worried about what's going on at home or they haven't slept the night before, it's going to be difficult for them to focus on anything else. So it's really just taking care of the behavior first before we expect a whole lot more.
So what do you do then to address all of this? In a day in the classroom, what do you do to help these children?
So the teachers and I and the administrative staff, we work as a team. So we create behavior plans for the kids that really individualize our approach for that specific child. So maybe they get overwhelmed and need to leave the classroom for a little bit, or maybe they need a calm approach. Some kids respond to affection and comfort. So it's learning that child and really providing a step-by-step of how to handle them in those situations. And then just supporting the teachers. They've got other kids in the classroom too that need their attention. Mm-hmm. So sometimes being the extra body to kind of help support them, and also give teachers the resources on understanding the trauma and also self-care so that they're taking care of themselves, because, preschool can be stressful, and so they've got a lot on their plate as well.
So, why would you encourage people to support Oakland Family Services and what we do for children's mental health?
There's such an overall approach here that really comprehensively looks at these kiddos and how we can best help them. These teachers are so dedicated and are really able and willing to address any challenging behavior in the classroom, and you have so many people who are willing to have a hands-on approach. And then we have services within our agency that we can refer families to. So there's a very comprehensive in-house approach where we can support and help these families and these children.
How does it feel for you to know that you're making an impact on these kids' lives?
I really enjoy working with them every day. It's, when I walk back and I get Miss Amanda's and they hugs, and it's fun, and you build the relationships, and the relationships I've built with the teachers, and they're very thankful of the added support that this position's been able to bring them.
Amanda's position that you just heard about is a grant-funded position. However, there's so much need amongst our children based on the mental health issues they're having, the trauma that they have experienced, that we have a need for funding to create more positions and create more support for these children. So by supporting us on Giving Tuesday, you can help us provide children with this service. If you're interested in supporting us this Giving Tuesday, you can give on our Facebook page. You can make a donation on our website at oaklandfamilyservices.org/giving-Tuesday. We really appreciate any support. The littlest donation still makes a difference for the kids we serve. Thank you.